recording. Okay, so we are recording in this computer here. No, it's not in here. So we welcome everybody to Chronic Disease Prevention and Management with Dr. Joseph James. Is going to talk about iodine, the clinical application of iodine supplement, and also iodine as an antioxidant, apoptotic agent, and also it's a differentiative agent. And it's very powerful antioxidant, same like methylene blue. It neutralizes the free radicals. So we're going to talk about that, and let's make sure that we have the welcome that this session is going to be recorded, and it's going to be CME credited information. And I think this is going to be an American Medical Association credit designation statement. It's part of Mini Great Lake Eco design. Designate this live activity of maximum of 2 AMA PRA category 2 credit hours. We're going to get it for physician. Should only claim the credit commensurate with the extent of their participant at these activities. And also there will be credit for the nurses and for all the members of the healthcare teams. And I think in Dr. Joseph, in your PowerPoint presentation, you have the disclosure and all that stuff. So you can go ahead and share your screen, Dr. Joseph, introduce yourself officially here, and we can start because it's 8 p.m.
Got it. Everybody see the screen?
Yes, we see it, yes.
Okay, so yeah, iodine. And as many of the things we've learned, they become much bigger in my mind than I thought. And iodine is definitely one of them, because as I was growing up, I thought of iodine as just something that's in table salt. And the more I learn, and please do chime in, I want this to be a discussion, but the more I learn about iodine, the more I start to see the light. And the big one staring in front of my face is that, iodine is it's antimicrobial. I mean, if you think about betadine and providone iodine and all of these things, I mean, this is actually an antimicrobial, and I actually found many different sets of literature showing what it's active against, and then also finding out that 40% of American people lack iodine. That was according to a previous lecture. So that's a big deal, especially in an age where our biggest problem right now is pathogens. And we're constantly being bombarded by pathogens that seem to be behaving like weapons. So there's more to iodine than reaches the eye. So let's just go to the summary here. Is awareness. We need to combat iodine deficiency and its disorders through proper diagnosis and treatment. Holistic care, to understand and utilize iodine's full spectrum of health benefits. Updated practices to integrate the latest research on iodine's extra-thyroidal benefits into patient care recommendations. It's not just about producing thyroid hormones. But that's also a big problem too, because if you think about hypothyroidism, even if it's not Hashimoto's and the thyroid is suboptimal because there's not enough iodine to be incorporated into the thyroid hormones, then think about all of the different conditions related to hypothyroidism. I mean, just anything, to chronic constipation, to blood pressure issues. I mean, all of metabolism slows down. And if you think of chronic constipation, then you think of even though this is not recognized, you think of SIBO, or small intestinal bacterial overgrowth, and it's one thing leads to the next. Research engagement to further study and have discussions on iodine supplementation to optimize patient care, especially iodine deficient regions. Professional growth to ensure health providers are informed about current health science developments, including iodine's therapeutic roles. This education is essential for providing comprehensive patient care and staying current with medical advancements. So, the purpose of this lecture, both in education and clinical practice, is to highlight the significant roles of iodine that extend beyond its well-known function in thyroid hormone synthesis. Objectives: educate healthcare professionals about the broader implications of iodine in human health, particularly its antioxidant, anti-proliferative, and immune modulating properties. So it is an antioxidant. And when I looked at the element, and of course, where they are on the periodic table, by the way, it's the group of halogens. And these halogens all have a similar features, that they have 7 electrons on their outer shell, meaning that they are seeking a final electron. Okay, and so that's what makes them able to scavenge free radicals, because they have that need, that attraction for that extra electron. And of course, when I looked at the halogens, the ones that we all know are fluoride, chlorine, and bromide, and then iodine, and those are the halogens. So there may be one more, but that's their commonality. The difference between, and you think about fluorine, chlorine, and bromide, I mean, we're using these things as disinfectants in some way or another. Iodine just happens to be the safest disinfectant that just happens to be required for our physiology and undergoing all these processes. So that's a big thing. The other thing I've learned is that, although this might be common sense to some people, is that these halogens, they don't survive. They don't exist by themselves. They are stable when they react with metals in order to form salts. So if you think about just in general, what salt, any kind of salt, whether it's chunky or fine, that's how it exists. The other thing to realize is that iodine is as prevalent then in the ocean. I guess that's because it's salty. Now, somebody correct me if that's not the really correct association. But the reality is that seaweed contains the most amount of iodine. And the other thing is going back through history, is that iodine has been used for infections for 150 years. In fact, earlier, because I saw that even in the early Greek times, that they would use seaweed, for very bad wounds from sunburn. I guess that's what it says. I guess they called it Lugal's solution, but yeah, it was used sort of as an antiseptic and to help wounds in general, going back that far. Continuing on with with these properties, anti-proliferative. Now, I don't know the mechanism of that. Now, that might be because of the conversion of estrogens to estriol, or and from my understanding, Dr. Halassa, which estrogen is the proliferative? Is it
Estradiol and estrogens, both of them are proliferative. Estriol, the one that of the pregnancy one, is the anti-proliferative. So one of the mechanisms is, yeah, switching those estradiol and estrogens, moving them to estriol. That's a good thing. And you see those patients having breast cyst, and when they take iodine, the cyst shrinks. You cannot see that with using any supplement. Even curcumin or methylene blue will not do what iodine can do. And that's the reason it does have anti-proliferative effect, and it induces apoptosis for all those inflammasomes and cancer cells and senescent cells. So yeah, it works as an anti-apoptotic agent for those bad cells, and that's very effective. That's why we use it for prostate hypertrophy, prostate cancer, breast cancer, to prevent. And even during treatment, it helps to enhance the chemotherapy effect, or it increases the sensitivity to chemotherapy using iodine. So it's a chemopreventive. It adjuvant chemotherapy without any side effects. And I really recommend everybody to be on at least 3 milligram. That's what's reported, 3 milligram of iodine per day, along with selenium, in order to prevent any, because iodine can be a little bit harsh on the thyroid if it's too much. But selenium will prevent that from having any effect on the thyroid, because high iodine, yes, it does may cause Hashimoto thyroiditis in a high dose. But the dose that we're looking for, around 3 milligram to 10 milligram daily, it's okay, because we're all iodine deficient. And the reason, as you said, the halogens, the chloride in the water, the fluoride in your toothpaste, the bromide in or the brome is in the bread. All of this is displacing iodines from its active sites, especially the antioxidant active sites. So yes, iodine works like methylene blue too. It does have electrons. It neutralizes the free radicals, so it works like an electron donor. I mean, iodine is. I mean, I don't know why we just catch up with it. It's because of Dr. Stefan. He's the one who brought it on the table, and we started investigating more about it. And I find it something that everybody has to be on it. Go ahead, Dr. Just.
Yeah, no, I give that Dr. give Stefan the props on that one for real, because I never would have thought all of these things were happening. I did see evidence in the literature that it displaces NRF2, which is the master regulator of oxidative stress, displaces it from the cytosol so that it can translocate into the nucleus and turn on those antioxidant genes, the glutathione, superoxide dismutase, heme oxidase, those very powerful antioxidants. And I believe that may have something to do with the immune modulating properties, Dr. Halassa. Would that be the mechanism? If you're buffering the redox, you're also simultaneously reducing some of the interleukins that are being expressed.
Well, most of the time, the immune modulator effect is because of inhibition of Th17 and activation of Tregs. As I said, in the dose that's less than 10 milligram, you don't want to go higher than that, because if you go above, it's activate the Th17, and it leads to Hashimoto thyroiditis. But as long as you go less than 10 milligram, you're okay. And yes, it does inhibit the Th17, so that's one of the immune modulator effect of.
Well, I mean, how
But Dr. Halassa, you mentioned that you can use it in cancer, but in cancer, you don't want to upregulate the Treg cells, because that is the contrary to what we want to do.
Yeah, you're right. You're right. I'm just saying the other part, because it doesn't have the Th17. Okay, and yes, it does for the autoimmune And for degenerative disease, it works on moving with Tregs. But in the cancer, as I said, it's you can see the effect of the iodine is inducing apoptosis and inhibiting Th17. That's a favor in the cancer. So most of the time, you may have one, you know, and any medication out there, you may have like 3 things is good and 1 is bad. In other words, 1 is not what you want. But that's fine, because the 3, which is the favor inhibiting Th17 and inducing apoptosis in the cancer cells, this is neutralizing those extra free radicals, which is the environment where the cancer is surviving. This is a good thing. Now, if you have 1 that is moving to Treg, still the 3 so it's good. You got my point? You will never get something like perfect, but if you have to balance to see that.
Well, I think that's what's meant by modulating. It's not pushing the button unnaturally and turning all Th17 to Tregs. It seems like when we're dealing with modulating, it's helping to restore a critical balance. And if Th17 is dominant in cancer, then, you know, balancing it back towards Tregs, it's not like it's turning them all into Tregs and turning them. And I'm just operating on intuition on this.
Well, again, let's say in the cancer, you have 2 things. It's Th17 and Tregs, they're active and they're pushing the immune system away from Th1. If iodine inhibits the Th17, that's a good thing. Now, regarding this bad side, which is moving things into Treg, then what you need to do, you need to work on giving other drugs that helps to prevent the Tregs, that will have the polarization to Tregs. And what is that? Thymosin alpha, interferon gamma, possibly adding anti-PD-L1, anti-CTL4. Then all of this will work to polarize the immune system away from Treg and move the whole thing to Th1. So you cannot, yes, for a cancer treatment, I'm going to say, oh, I'm using iodine and that's it. No, iodine is just an adjuvant, but you need to add other layers, other drugs, in order to ensure it's going to be.
It sounds like what I'm hearing is we should have optimized iodine levels naturally. If we were eating a proper diet, you know, like Japanese, they have a lot of seaweed in their diet. Something got taken away from our diets. That's what I suspect, that pulled us away from iodine containing foods, and so we're deficient. So this isn't about giving an IV of iodine to treat cancer. It's about having optimal levels so that these components of our immune system are balanced properly.
Yes, as a chemopreventive, let me integrate there. As a chemopreventive, yes, this is the best thing you do. It's giving iodine. Now, you're talking about deficiency. The deficiency is because of our water is full of chlorine.
Okay.
Chlor replaces the iodine. Let's say the iodine is working on this antioxidant enzyme. Then what would happen? The chlor would take a place of it and block that. So you don't have much of antioxidant machines working. And and that's why you get up with the brain fog. And then the iodine also helps to keep the balance in the estrogens forms, the 3 forms, and move things into estriol. So you don't have too much of proliferation going. And that's a good thing for cancer, especially for prostate hypertrophy and prostate cancer and breast cancer, which is the top reason of having cancers. And so the halogens is replacing and preventing, instead of absorbing iodine, we're absorbing halogens. The fluoride that's in your toothpaste is taking its place in its absorption and its actions. And so iodine helps to detox you from those halogens and replace them and push them away. And so that's the reason why in the Western country, it's because our water is full of chloride and our toothpaste is fluoride and the bread is contained bromide. All of this is causing iodine deficiency. And that's the reason we need to add at least 3 milligrams a day of iodine in all our diets. And it is the best, especially for prostate hypertrophy, patients above 50. It's because of estrogen dominancy that's causing prostate hypertrophy, and iodine helps that. But also the prostate iodine has direct effect and differentiating effect, which will balance the excessive proliferation effect. You got my point?
So when
Yeah.
you give more iodine, where does it go in the body?
I think the body get rid from it from the urine because you can see. Remember when you give
My understanding is that it's uptaken mostly in the thyroid and the breasts.
we're talking about the pharmacokinetics. Yes, the iodine is mostly excreted in the urine, and that's the reason. Do you remember when you take the 125, the radioactive iodine to treat prostate cancer? We give that to them, and you check their urine. When you do the PET scan, or they do the scan, the iodine scan, you will see the highly concentrated in the bladder. So iodine in general, we get rid from it through urination, and that's a good thing, especially for prostate hypertrophy and all that stuff. You get that iodine in the prostate enough to prevent it from happening and causing shrinking. And in
So
the
if
breast,
that is true, then the serum iodine level should be the marker. So if it is high, then you bring, or because what I understood that once you start yourself on iodine, then if you do the iodine levels, they are not very I mean, it doesn't guide you about it is high or low, because it's always going to come higher. And so you do the level before, and then if you want to do it, you can do the saturation, but you can not follow the blood levels and say, oh, now your levels are normal, and you may not need it.
yeah, I agree with you. There is technical there that we need to clarify, but your point of you have a lot of technical expertise, Dr. Patel. So we're the ones going to learn from you, and I agree with you.
Yeah, no, and all the input is fantastic. Thank you, Dr. Patel.
Right.
Yeah,
just let me just cut a little bit here for people who just can join us. We have now 19 people. Can you go to the general chat room, making sure that you are because there's CME. If you want to have the CME and also you want to support this weekly webinars with CME, then there is a link that everybody needs to go to, and it costs $30, and you get the CME today. Just fill it out. It's so easy, and you get your CME, which is 2 hours worth of credit of CME. Just go to this link that I send it to you in the chat room, please, for all the comings, and click on it, fill up the form, and you get your CME. We want to welcome Dr. Klatz here. He just joined us. Where you be, Dr. Klatz? You're late. Okay, Dr. Joseph, go ahead.
Okay, so basically we're talking about all the different properties of iodine, and just to recap, also its anti-infective properties being used for 150 years and even longer as an antiseptic, being shown to literally be active against gram-positive, gram-negative bacteria, spores, amoebic cysts, fungi, protozoa, yeasts, MRSA, even viruses. And although that one may not be specified in this lecture, the other thing is it possible that if we had our iodine levels optimized, would that also give us more resistance against infection? Okay, because there's a lot of I saw a lot of articles even with iodine being used for like bladder irrigation during surgical procedures, acute wound irrigation, intraperitoneal irrigation, and now realize that is used in a form of providone iodine. It just basically adds a polymer to it so that it's more stable. But iodine, it's multidimensional. Now, going on here, encourage consideration of higher iodine intake in certain pathologies based on emerging evidence is its extra thyroidal benefits. And like we said, it's also absorbed not only by the thyroid gland, but it's absorbed by the breasts. And when you mentioned that what's happening is that the chloride, the fluorine, the bromide is sort of taking its place, is it possible that those are also depositing in the breasts and contributing to some of the breast issues, and iodine is not able to go where it needs to go, or we're not getting enough of it, or those positions are being taken by the other halogens, those other halogens being much more irritating than iodine. Promote further research and discussion within the medical community regarding the optimal use of iodine supplementation in clinical settings. By understanding these multifaceted roles, practitioners can better assess and incorporate iodine's potential therapeutic effects into patient care, especially in areas of high rates of iodine deficiency disorders. Like I said, I pulled one stat showing 40% of American people are lacking in iodine. Now, just to make sure that we're clear, do I have to read this out loud, Dr. Halasa, or does this speak for itself? That there's no conflict of interest? Okay, well, I'll just keep going. The multifaceted roles of iodine beyond thyroid hormone synthesis are fascinating. Here's a PowerPoint presentation summarizing the key points. Seaweed, a dietary staple in Asian communities, is rich in iodine. The Japanese people who consume seaweed at a rate 25 times higher than in Western countries exhibit a low incidence of benign cancerous breast and prostate disease. Now, one thing I can tell you is there's been a lot of emphasis or a popularity now I'm starting to see in sort of the seaweed supplements or seaweed concoctions or versions of seaweed that are being advertised as being able to help so many things. And obviously something that's immunomodulatory, that's antioxidants, but also at the same time, it's has the possibility of producing apoptosis in cancer cells, but it again also may be adding to resistance against pathogens or actually killing pathogens, possibly. And like they said, they have lower cancerous breast and prostate disease, and we know that its effects on the breast. Okay, again, it neutralizes free radicals. Why? It's because it has 7 in its outer shell, it has 7 electrons. It needs 1 more to be stable. That's 8. 8 will make it stable. So it's sweeping those free radicals. Iodine can act as an antioxidant by neutralizing free radicals, which are unstable molecules that can damage cells and contribute to aging and diseases. It induces the expression of type 2 antioxidant enzymes. These enzymes play a crucial role in the body's defense against oxidative stress. Now, these type 2 antioxidant enzymes, that's what I explained before, when iodine releases NRF2 in the cytosol, translocating it into the nucleus, activating glutathione superoxide dismutase heme oxidase. It inactivates pro-inflammatory pathways. By modulating these pathways, iodine can potentially reduce inflammation, which is linked to various chronic disease. So, summary. Now, I know I'm repeating myself over and over, but I guess maybe it's good to drive it into our brains. Anti-proliferative. Now, Dr. Halasa, just so I'm clear, it's is estrone is that the most proliferative of the three estrogens?
Yes, estrogens and estradiol, both they do proliferation. What's the difference between estradiol? Estradiol is proliferative, but it's anti-inflammatory.
Okay.
Estrogens is proliferative and inflammatory. Estradiol, it's anti-inflammatory and differentiator. So what you need in order to prevent excessive growth that's not differentiated because of too much of this estradiol estrogens, especially the estrogens, it's not just, it's inflammatory. I mean, estradiol is a good thing about it, it's anti-inflammatory. But both of them, they induce proliferation.
Well, okay,
we need the proliferation for regeneration. You need regeneration. You need the mTOR activities, right? But at the same time, you need to make sure that there is differentiation. And so you need to balance those estrogen forms so you have enough of estriols to counteract the proliferative effect of estradiol and estrogens. Or you can add progesterone to balance that as well. So progesterone and estriols, they work the same, and iodine, all of this works the same thing. They're anti-inflammatory and differentiation. You got my point?
Yeah, so that's my question. So progesterone is similar then to estriol.
Yeah, similar to estriol. They work the same thing. They do differentiation and anti-inflammatory. And also they decrease the expression of estrogen receptors, which that's what you want when you're trying to prevent breast cancers and all that. And you prevent this excessive, because if the cells is dividing too much without differentiation, what will happen? You don't have time for the cells to build enough of antioxidant machines. And then they get oxidized. In other words, they become source of free radicals, bad ones. And so progesterone will say, hey, stop, we hold on. Let's differentiate, let's mature before you're just dividing like crazy. I mean, we still need the proliferation, we need the replacement of cells, and that helps us to, stay young. But at the same time, we make sure there's differentiation. If there's no balance there, you end up having cancer and a lot of problems.
Got it. Yeah, and iodine is not preventing the conversion from testosterone to estrone. That's
yeah. It does have aromatase inhibitor. The iodine does have also its aromatase inhibitor. It prevents the testosterone from becoming estrogens.
Okay.
So that's a good thing too, especially when you manage estrogen dominant syndrome, right? So you give progesterone intranasal and also you give iodine. Both helps to prevent and manage estrogen dominant syndrome.
Okay, so basically it's the only thing that we have that's really hitting two things at the same time. The testosterone conversion to progesterone and
the testosterone conversion to estrogens and the prevention and conversion of estrogens into and stimulate the conversion of estrogens to estriol. Yes.
Or yeah, exactly. So wow. Okay.
Right. Iodine is. I mean, this thing is missing, and we have a problem in Western country because of the halogens. We are toxic with halogens, and this halogen is replacing iodine. It's preventing it from absorbing in our body, and it's also taking its place. And that's why we end up with all this fatigue, and it also leads to estrogen dominancy because iodine is very important to balance the estrogen forms, and it inhibits the aromatase, the conversion of testosterone to estrogens, and it does help in weight loss. It helps to activate in the mitochondria as well because they work like methylene blue. They are electron donors, and so they can produce NADH and ADH. So they are like methylene blue in terms of improving the mitochondrial function. So I mean, it's just a great molecule that we are missing it. And I think everybody here needs to be on iodine, if especially for men. We have how much the risk of having prostate hypertrophy at the age of 50%, and then 60%, 70%, 80% will have prostatic hypertrophy. So if you take iodine, that helps to slow that and decrease that. Even the risk of cancer, 50%, everybody here. And if you take something that helps to differentiate and induce apoptosis and all that stuff that iodine does, and counteract the estrogen dominancy, hey man, this is the drug everybody has to be. Everybody here in this room has to be on minimum 3 milligram. And I'd like to appreciate and thank Dr. Stefan for bringing iodine to the table. Yes.
Now, if we have a lot of seaweed products, or I've got over here, I've got Irish sea moss, and if you're making smoothies every day, I'd be curious. There's some other supplements, but not supplements, but
make sure you add that selenium and magnesium, especially selenium, to prevent from going to excess of iodine and causing the thyroidites. Selenium helps to calm that, put it down. So as long as you combine iodine with selenium in your supplement, you're good.
Well, and this isn't really a supplement. I'm talking about if you're making a smoothie. I've been practicing and learning and putting together smoothies, because I want to get those valuable minerals, and these are such nutrient rich products that I have. But again, many of them are sort of coming from the sea. So selenium is sort of the balancer of iodine. And I did see that the studies in those articles talking about, is it the selenium that's reducing the breast cancer? Is it the iodine?
The iodine. But selenium helps to prevent the iodine from being so much.
Basically, it seemed like it was always having the best combination was having optimal iodine and optimal selenium. Selenium by itself, no, isn't reducing it. Okay, so
selenium is very powerful antioxidant, but it's not.
Well, I think that selenium is important because it helps the glutathione recirculation.
Yes,
and
for antioxidant.
So I think that even if you don't have, of course, it is good to have it with iodine, but by itself, it is used for years together before the other things came around. Selenium was used in a cancer patient in a larger doses. Usually it is 200 microgram. In cancer patients, you can give up to 400 to 800 microgram. So there is a place of selenium in a cancer patients.
Yes, I agree with you. But if you tell me which will be the most effective anti-cancer, anti-proliferative, anti-apoptotic agent among all the supplements up to now, including curcumin, selenium, all of them, they have some rule, because just buffering the redox itself, because cancer lives in high redox level, which is oxidative stress than normal tissue. And just buffering it prevent you're providing an hostile environment for the cancer. So I'm with you in terms of redox buffer, so selenium, or its antioxidant power, because it's part of the enzymes of the antioxidants. But in terms of anti-cancer, the top is iodine. I mean, so you can see cases with breast cysts taking iodine and the cyst shrinks. I mean, that's a big thing. And prostate hypertrophy, prostate shrinks by just giving iodine. You will not see it with any other agent supplement that's safe comparing, if you go ahead with the study head to head. But I agree with you with selenium. It's very powerful antioxidant, increase the glutathione is part of the superoxide dismutase, is a cofactor there. And combining iodine with selenium, I think it's the best way to go, along with some magnesium, to make sure that those three minerals are in the equation.
Yeah, and I'm wondering if part of its anti-cancer effects, again, are because it has anti-pathogen activity. I brought up the concept last week about more of a question. What if there's a pathogen behind every cancer, or it's multiple pathogens leading to, and you can't really say no, because think about
I think you're right. I mean, they have done, and any chronic persistent disease, which is more of a degenerative disease or cancer, there is an infectious pathology. Like in Alzheimer cases at the Harvard, 100% of the patients that they found that there was Lyme organism present. In a thyroid dietitian, thyroid cancer patients, they saw that more than 80% had positive for the parvovirus, HHV6 and HHV6. So
which virus?
HHV6.
For thyroid disease.
Yeah, yeah. So what I'm trying to say is you are on a right path. Yes, there are the common organisms are like, there are so many HPV cancer. So a lot of head and neck cancers are related to the HPV along with the cervical cancer. And there are many more, but there are if you look for the different organisms, you will find that the infectious disease plays a great role in a chronic. So I'm not just only limiting it to cancer, but also the chronic degenerative, neurodegenerative disease, the thyroid diseases. So and if you look at only the blood levels may not be elevated, but when they do the tissue testing, then it is positive. So if you go and start doing the blood level and then deciding that this patient does not have this organism, you are on a wrong path, because the tissue selectivity, and it goes directly.
Measuring what in the bloodstream? The iodine or
the titers? No, the titers for the infectious organisms.
okay.
All right. Let me add something. Epstein-Barr virus, it's well-known cause of lymphoma and some blood cancer diseases. So I agree 100%. I mean, human papilloma viruses, even fungus infection, when you have any chronic inflammation, infection, it will compromise your immune system because you are pushing it away from cytotoxic T cells, and you compromise the immune surveillance of cancers. So any chronic inflammation, any chronic infection, and there's carcinogenic viruses that we know, human papilloma viruses, Epstein-Barr virus, those are carcinogenics. So the infections are part of causing it. Estrogen dominance, as we talked about, is also one of the causes of the cancer that needs to be managed. And if it's done wrong and you start giving the sex hormone the wrong way, you may cause estrogen dominance instead of treating it. So it's very important that we give the sex hormone balanced, and we give iodine. That's something it's part of. It's going to be part of your sex hormone therapy. You add iodine because it helps to regulate those three forms of estrogens and balance those three forms and make it in a way that's balanced. So you don't have too much of proliferation of estradiol and estrogens. It's being balanced with estradiol. And yeah, adding progesterone would be another thing.
Okay, and then I was just going to quote something here. The mechanism of action of iodine, as far as what it does to a pathogen, the example here of bacteria is that it penetrates the bacterial cell walls, and it does all kinds of things. It denatures their DNA, destabilizes the membrane, basically disrupts their entire system, and it kills it. And a similar mechanism is happening for the viruses, the yeast. It has something to do with their outer wall. The 7 electrons, missing 1 electron, that allows it to penetrate all of these different, whether it's fungi or protozoa, viruses, amoeba, even spores. And so imagine, if you had optimal iodine levels the way that we should, we would already have a degree of protection. But with 40%, and it's probably higher, of Americans being deficient, well, you're already losing part of your defenses. And then, of course, then it also affects the hormones, and then the hormones are dysregulated, and it's just a domino effect. Okay, so helps organ integrity. Iodine contributes to the normal structure and functions of organs by influencing cell growth and differentiation. I guess that has to do with the balance between proliferation and maturation.
Yes, it gives you that differentiation effect that you need to balance the proliferation effect of the estrogens and estradiol.
Oh, okay, so it goes back to the estrogens then. Okay, so suppresses
But it
the
directly also, it helps like vitamin A. Vitamin A, iodine, directly they help in differentiations of the cells, gene expression, all that stuff related to
That is the reason that, the seaweed is good because it's rich in vitamin A, it's rich in magnesium, rich in iodine, rich in selenium. So I mean, you and many more things that it is the food for the stem cell growth. And that there is a Dr. Drapo, he has done a lot of work on that. And the theology. So I think that, yes, individual nutrient is important, but there is, if you can supplement with the food, it would be magnificent.
I agree with you 100%.
yeah, absolutely. Suppresses the development and size of benign and cancerous neoplasias, as we spoke about. Iodine has been shown to have anti-proliferative effects, which can help in the control of growth of tumors. As far as triggering, talks about it right here. 3 molecular iodine supplementation. And of course, we'll talk about that, what that means after this. Direct actions include oxidized iodine dissipating mitochondrial membrane potential, triggering apoptosis. This leads to the controlled death of damaged or unnecessary cells, which is vital for maintaining health.
So this is what's happening to inflammasomes and cancer cells and senescent cells. The iodine helps to get rid from them by blowing up the mitochondria. So iodine in healthy tissue, it's actually stimulate the mitochondria, and it helps to enhance the electron transport chain, and it helps also in weight loss and fat reduction because of the burning of the fat and the beta oxidation.
Now,
when it comes into abnormal cells, iodine does the opposite. It blows down those mitochondria, because the mitochondria inside the tumor cells, they're like bombs. So if you activate them, they will blow up, right? And that will kill those cancers. So that's what exactly how they work. So it's a very strong chemopreventive. And because we have high risk of having prostate, breast cancer, lung cancer, those are the top cancers that we know, I think everybody above 50 needs to be on iodine to reduce the risk of those cancers, which is 50%. It's a flip of the coin that everybody in this room will have cancer. So why we don't start recommending the patients of giving them iodine and balancing their 6 hormones and lowering their weights. If you want to use this semaglutide, tirzepatide, that's fine. But as long as you provide with it amino acids and you provide them multivitamins to counteract the side effects, I'm good with it.
And okay, and I was going to say, you said it works similar to methylene blue on the electron transport.
Yes, it's electron donor. Yes, same like methylene blue.
Because it has the same sort of potential that allows it to donate and receive electrons at different levels.
So it's a redox buffer. It's a very powerful, good one. It's a good one.
Okay. Yeah, I mean, the way to stop cancer, I think a good way to think about it is maybe reframe our thought process about it and say cancer is easy to prevent. Because if you have the algorithm, you know exactly what you're supposed to balance out, and you balance it out, well, then you're not going to get cancer. I mean, that's a simple way to put it, but we may want to not overcomplicate cancer and realize that there's some basic fundamental imbalances that are allowing cancer to happen. And we've been ignorant, I guess you could say, to what's going on with iodine, and if you're and with chlorine and fluoride and all this stuff, flooding our system and preventing iodine from reaching its destination, plus the diet not having much iodine, it just makes sense. Okay, indirect effects involve iodolipid formation, activation of peroxisome proliferator activated receptors type gamma called PAR. Now, these PAR, the way I try to remember this, because it's hard, the way they name these things is it is a receptor on the nucleus. And when I think of PAR, I think of golfing and trying to get it onto the green. So if you imagine like the nucleus is sort of like, you know, with the flag, you're trying to get the golf ball on the green and to make par. That's the only way I can remember this, because that's a major regulator, a transcription factor that changes gene expression depending on whether it's inhibited or if it's stimulated. These actions can lead to the activation of pathways that result in cell differentiation or apoptosis, contributing to the regulation of cell turnover and prevention of cancer. So that, I guess that's another action besides the electron transport chain, in that it is involving iodolipid formation and activation of PAR, leading to activation of the pathways that result in cell differentiation or apoptosis, contributing to regulation of cell turnover and prevention of cancer. And maybe it's turning on a P53.
Is it activating P53?
Yeah, I think I connected the two. PAR activation leads to activation of P53, which initiates the apoptotic pathways.
That's possible, yes.
Okay.
I'll confirm it later, but
okay. Yeah, I just like it, you know, yeah, like it to make sense. Otherwise it otherwise it looks like gibberish.
yeah, just in general, iodine induces apoptosis for cancer cells, inflammasome senescent cells, whether it's through PARP or through P53. You know, what's important is that iodine is something that we can rely on it as a chemopreventive, as a powerful top chemopreventive among all the supplements out there.
Yeah, I wonder why that is. I mean, did we, you know, I mean, did we live in the sea or in the oceans or something where we fish or something? I mean, it's just.
I hear that the shark does not have cancer. I mean, and they are investigating the reason, but possibly iodine is giving part of it. You know, this chemopreventive for the fish, comparing to the creatures on the dry land. Possibly they have less cancer than us.
Yeah,
living inside seawater.
Wouldn't surprise me.
Right.
Okay, summary. In addition to these specific actions, iodine is crucial for thyroid health, as it is needed for production of thyroid hormones, which regulate metabolism, growth, and development. You know, and let me read. I took a snapshot of. You know, you have to also remember when if you're not producing enough thyroid hormones, because the iodine is essential. It's incorporated. It's part of the thyroid hormone molecular structure. And if there's not enough iodine and you're not producing enough of the thyroid hormones, or it's suboptimal, I mean, you really have to think about all of those effects. Here's just a list of thyroid and other endocrine imbalances. Allergies, anxiety, arthritis, cancer, candida, chronic fatigue, coronary artery disease, cystic breasts, cystic ovaries, depression, diabetes, endometriosis, gout, hypertension, hypotension, infertility. I mean, hypothyroidism and infertility, I mean, they go hand in hand. Mental disorders, multiple sclerosis, obesity, PMS, psoriasis. I mean, so many things when you really kind of look at it. you start looking downstream at all of the effects from low thyroid or suboptimal thyroid, and it's just an endless, seemingly endless list of like a domino effect. It's also important for brain development before and after birth. We need our brains. However, it's essential to maintain a balance, as both deficiency and excess iodine can lead to health issues. So I think that's the other thing to realize, is that there's always a balance. Too much of anything is a bad thing too. So perhaps there's a toxicity to it. And remember, iodine, it's related. It's a halogen, just like chlorine and fluorine. It just happens to be needed by our bodies.
Right. And
And
the toxins of it can activate the TH17 and cause inflammation and thyroid. So we make sure that we don't do too much of it. And from 3 to 10 milligram a day, I think that's good enough. Don't go above that.
okay.
Right.
And always consult your healthcare professional. We'll just add in there, open-minded healthcare professional before starting any supplementation. Okay, recommendation. The International Council for the Control of Iodine Deficient Disorders should consider increasing iodine intake to at least, like you said, 3 milligrams per day in specific pathologies. And what does the iodine I2 stand for? Is that the iodide?
That's the iodine, because there will also be iodine, potassium. Yeah, so this is the iodine as a molecule. Inderal, yeah.
Basically, it's like bound to itself, like O2, like oxygen,
Right.
O2.
As a molecule, not with potassium or with other thing. Yeah.
Okay.
Not an ionized form, in a molecule form. Yes.
Okay. In specific pathologies to harness the potential of extrathyroidal benefits, extrathyroidal effects on iodine, antioxidant properties. Iodide directly neutralizes free radicals. It induces expression of type 2 antioxidant enzymes. Those would be like glutathione. Inactivates pro-inflammatory pathways. And I think that whole process of inactivating or unleashing NRF2, I think that it's like the opposite of NF-kappa B. If you turn that on, it must turn NF-kappa B off or turn it down. Or
yeah, the iodine is a very important cofactor of antioxidants, and also they involve an expression of antioxidant enzymes. So they are a redox buffer, a powerful one. And directly as a molecule, they neutralize those superoxide radicals and those bad high pathological free radicals.
And the superoxide radicals lead to NF-kappa B activation.
Too much of it, yes. And then you end up with pathological free radicals. What you need is a spark of free radicals, physiological one. You don't want to have the pathological constant high. That's what's happening when you're being exposed to infection and fungus, and you're being exposed to the 5G. You end up with constant high free radicals that leads to all this pathological process and induce the TH17 and inflammatory cytokines.
Got it. Neoplastic cells, iodide generates iodolipids with nuclear actions, activates apoptotic pathways, like we said, perhaps P53, activates PAR, inhibits markers related to stem cell maintenance, chemoresistance, and survival. Inhibits markers related to stem cell maintenance. Not quite sure what if I'm missing something there.
I think it's talking about maybe cancer stem cells. Just
cancer stem cells. Okay. Yeah. All right. Immune modulation. Iodide can function as an immune inhibitor or activator, depending on the cellular context. In conclusion, considering the potential benefits, increasing molecular iodine intake in specific pathologies could be beneficial. Obviously. Dosage recommendation, 3 milligrams a day of iodide. 2 atoms of iodine bonded together, just like O2. In specific pathologies is a call to action for both researchers and clinicians to explore these benefits. And we are finished. I thought that was a good exercise.
Yeah, it's short and sweet. It is short and sweet. That's a good thing about it. That's a good, yeah, I mean, again and again, please, to support this weekly webinars and to obtain your CME, I would like everybody, even if you're not in need of CME, just to support it. It's like having a dinner, and you have the website where you go in, and you go ahead and just fill the forms, and they will send you immediately. They will send you your credits, so you don't really need to travel and all that stuff. Maybe so if you do that every week, you end up with 8 hours of credit per month. And if you do it every year, I mean, a year, that's around 8 multiplied 10 is 80, around 100. You get 100 credit per year. I think that's enough for renewing your medical license, and also supporting the innovations and pioneers of doctors here who are creating new protocols, cutting edge solutions for unmet medical needs. So, any questions for Dr. Joseph? Congratulations, Dr. Joseph. It's the first CME for 3 years or 4 years. We're doing this, and this is the first CME we offer, and hopefully it will be every week. Anybody has questions for Dr. Joseph? Now, regarding the question where you get the 3 milligram per day, if you just PubMed that last statement of recommendations, you will see. Just write down 3 milligram iodine per day, PubMed. In a PubMed, you will see that in a very clear publication there. Any questions, Dr. Klatz? Do you have any question? All the time we honor Dr. Klatz is with us, supporting us and helping us here. Questions for Dr. Joseph James?
Yes.
Yes, I do. Go ahead.
Okay, go ahead, please.
So I just looked for P53 gene because I just didn't want people to go home and think that iodine has a direct effect on a stimulation of P53 protein or gene. It works through the thyroid, and thyroid has an effect on the immune system, and through that, they think that it may have an effect on P53 gene or protein, but it does not have a direct effect on it.
Oh, thanks for clarifying. And that's why I always try to be very specific when I'm not sure, but I think there's a connection. I just say that that's simply the case. I'm not sure, but I thought that P53 was tied to stimulation of the that PAR transcription factor on the surface of the nucleus.
Okay, but what I found that the thyroid hormones can influence P53 gene expression indirectly through various signaling pathways, potentially impacting the cell cycle regulation and apoptosis. And then the second one is the reactive oxygen species and free radicals, which are known to induce the DNA damage and contribute to cancer development. So through that, but not a direct effect on P53 gene.
Okay.
And so the cell cycle, survival, and apoptosis, they are also the effects of the like a suppressive effect on the cancer cells. So it is through that effect of the cell cycle, effect on the cell cycle.
Okay, and then probably it's affecting
MAPK signaling pathway, which can interact with P53 signaling.
Okay, so that's another indirect route. Okay, and then I would think that senescent cells would be affected too by iodine to a certain degree, and because if there's a similar process happening, with cancer cells, maybe the same thing is happening with senescent cells.
Right.
Okay. What else? Yeah, I mean, it literally, the way it's designed, it passes right through pathogen walls, penetrates their walls, has something to do with the 7 electrons in their outer shell, excuse me, and that this is effective, apparently, according to a source, spores, amoebic cysts, fungi, protozoa, yeast, even MRSA viruses, gram-positive and gram-negative bacteria. I mean, it's everything. So, yeah, any other questions?
Dr. James,
yeah.
Dr. Klotz here. Dr.
Hi.
James.
Go ahead.
Anyway, I want to thank you. It was a very good presentation, and it's a timeless topic that has been for some reason swept under the rug of medicine in the good old days prior to big pharmaceutical medicine. Thyroid was a mainstay of antisepsis. I remember listening to a couple of interesting lectures on the topic years and years and years ago. And one of the things that stuck with me was that the organ of the body that has the greatest amount of thyroid, greatest amount of iodine, rather, is the thyroid gland. And the reason for it is that there's so much blood flow through the thyroid. I believe that almost the entire circulation of the body travels through the thyroid in a matter of just a few minutes, that the thyroid acts to release iodine and is the major antiviral organ of the body. And so without enough iodine, viruses seem to have their way.
Well, then I would think too, that's leading to all of the Hashimoto's thyroiditis. Just if it's possible that, and I believe Dr. Patel had mentioned it earlier, that a high amount of Hashimoto's cases is the result of herpes type 6 virus. Is that correct, Dr. Patel?
Yes.
Okay, so if herpes type 6 then is able to replicate within the, say, the epithelium of the thyroid, it's doing it without any resistance to iodine, which would normally be protective because of the diminishment of iodine, probably much less iodine within the thyroid gland than there used to be.
So now is the question, is that how does that low dose naltrexone works for the Hashimoto's thyroiditis? I have multiple patients, they were high and they're low now.
Yeah, the naltrexone inhibit the Th17, and Hashimoto thyroiditis basically is Th17. Some of them are Th1 along with Th17, especially the one that has lymphoid nodules or lymphocytes, or what we call the lymphoid or lymphocytic inflammation. That's more.
So you think that HHV6 may be causing the heightening of the Th17?
Well, maybe this.
Cytokine?
Maybe it's carcinogen. It's possibly to trigger the inflammation. The Th17 is the main thing. In any autoimmune diseases, Th17 is the first thing you need to declare.
Right, but I mean we are one step ahead of that.
Right.
So autoimmune disease, what is the initiator of autoimmune disease?
Yeah, right.
And so we are right now, we were discussing about the infectious agent, and in that maybe we know that in rheumatoid arthritis, antibiotics work. Why do antibiotics work? And if I have a couple of patients that they are antibiotics. They don't have to go on the biologics.
Which one antibiotics you talk about? Not all of them. Some of antibiotics does.
Yeah, rheumatoid arthritis.
Yeah,
And it
some
is by the
antibiotics
Rheumatoid
does
Foundation too.
exactly. Some antibiotics have immune
That's right.
modulation, like
Well,
ivermectin, for example, hydroxychloroquine. I mean, tetracycline. They have Th17 inhibitor. They are anti-inflammatory.
Let me add something though, but is it possible? And this was according to Schallenberger's lecture, and he just simply quoted a study that was showing that mycoplasma could be cultured out in the joints of rheumatoid arthritis patients in a fairly high percentage of them. So there was a connection between.
So that's right. That's why the Zithromax works on them, doxycycline works on them, and you don't have to give in a high doses. You can give like Zithromax 250 milligram or doxycycline 100 milligram. You don't have to give in a high acute exacerbation cases, and to use also the high dose ozone or ozone biophotomodulation treatment, and that carries on for a long time. So there are treatments that we are using. Now we have to look again at the causation, because we are over and beyond what is published in literature. We are right now doing the brainstorming, and we have to think that maybe it is probably the infection leading to the Th17, leading to the activation, and as a result there may be autoimmune activation, and autoimmune disease may be there. Depends upon what is activated.
I mean, is it possible to almost see it differently? Because, okay, say you get this chronic infection, you first get the innate immune response, you get the monocytes, the macrophages, battling it, and then they start presenting to the T helpers.
Right. So what you're talking about, the innate immunity.
My point
Then
is
going to the adaptive.
my point is that it leads to a Th1, say first maybe a B cell response, then a Th1 response. But if it keeps going, okay, say this organism is already gotten its way into the joint, then we get the Th17 polarization, which brings in the neutrophils. And as I understand in my conversations with Dr. Halasa, that's like the B52 bombers then come in. If like the innate response isn't working, the B cell antibodies are not working to get rid of it, the cytotoxic T cells are not getting it, then it's polarizing the Th17 and bringing in the B52 bombers, and that's where all the destruction happens. And but they make it sound like it's our immune system is just is attacking itself. Well, what if it's attacking the pathogen, but it has to resort to the B52 bombers. And so while it's attacking the pathogen, yeah, there's going to be destruction of the city as well.
So I think just every meeting, we just do the brainstorming and come up with some of our indications that why we think things are working the way they are, and start thinking outside the box and use some of the things that what we are discussing. Patient will get better faster and remain in a better state for a longer period of time.
And then perhaps, I'm sorry to jump in there, and then perhaps when we think of chronic infection, we've got to get to those as soon as possible, or we have to actually address them in addition to modulating the immune system. But the sooner we get to any kind of infection, we don't want it to get to that point where that, you know, then it starts to become, like I said, the TH-17 bring in the B-52 bombers. We want to try to get ahead of it before it gets to that point. If we can eliminate the pathogen, or just have the mindset that there's a reason, it's not just random stuff. Pathogens seem to always be, you know, from what I'm starting to intuit and translate from all this stuff is the deeper I look, the more I see that there's a pathogen associated. And then if we open up our eyes and realize, wait a minute, there's some crucial molecules that we're lacking, like iodine. We have to spot those crucial master molecules, we'll call them, the ones that we don't realize that we're deficient in, or like I said, we're in this case it's you know, competing with chloride and fluorine and bromide, and you know, once we can realize that. But I'm curious, what other situations, master molecules are we deficient in for similar reasons? So it's just, again, I'm just talking out loud what I think, and just trying to reinvent a different way to think about it in general, because that makes a lot more sense than the fact that, oh, it's just random autoimmune diseases for no apparent reason. The immune system just gets confused and starts attacking itself. I'm not so confident about that anymore.
This is very, very good, because there's another autoimmune condition, which is multiple sclerosis. And then my patient had a acute Lyme disease and was misdiagnosed as a multiple sclerosis without being diagnosed as a Lyme disease, and he was not responding to the steroid treatment, and then he was told to go on the biologic treatment, $60,000 every 6 months. And then mother brought her son, who was like in his 30s, and he was in the wheelchair. And in 4 days, we made him walk with the stick, the cane. And then once the diagnosis came, we started on an IV treatment of antibiotics. And then I treated him with the TB4, very high doses. And in 6 weeks, he reverted completely to normal. And of course, I gave him methylene blue. I put him on the whole body laser treatment. And in 6 weeks, he was completely normal. And now he's still, 4 years later, he's still in remission. So I just want to think, whenever you see the autoimmune condition, go a little bit more in detail, and it's always pays back to do some FBI work and find out the causation, and try your newer technique that may help.
Sounds great. Well, that's all I've got for tonight, guys. I feel pretty good. Anything else? And then maybe we can go
Yeah.
call it a night.
Okay, sorry to keep you going, but I wanted to talk about the dosing of the iodine. I would think that you would have to eventually individualize that depending on where you live. Are you in or out of the thyroid belt? What is your diet like? Do you actually eat good food? And what are your exposures? If you are using a non-fluoride toothpaste, if you are either using a reverse osmosis system or have well water or do both, if you do not eat a lot of bread, you may not need as high a dose. And then what your pathogen exposures are. Do you have any chronic infection? Are you chronically exposed to things like fungi, or do you have any form of herpes virus? I would think that all of those would influence your dosing in the end. I think it could use some work.
Yeah, I agree with you, Dr. Deborah. I think Yeah, all of these factors will count in. But in addition to that, you can also measure the iodine. And knowing if you have iodine deficiency, I'm trying to bring the lab to do that. But yes, we can measure it, and then with all these factors, that will give you the understanding that this patient may have iodine deficiency, but you can confirm it with a lab test as well. But thank you for bringing that up.
Yeah, I wanted to know because I somehow missed what is the testing that you're doing?
There is a way you measure the iodine in the blood, or there is a test for it, and you can measure the iodine level in the body.
Okay.
That's one thing. And then with all the factors, all the contribution factor of iodine deficiency, you take from the history. I think that's a good thing. You know, the history and exam needs to be comprehensive. Then yeah, that helps to narrow down and even know that the patient's at risk of iodine deficiency. But I like that the idea of history and exam needs to be done and then confirmed with the lab. It gives the patients or the doctor better understanding about the patients versus just going, you know, giving them everybody iodine. And I think personalizing it is a good idea. Yes.
Well, so Stefan was doing a test. I don't remember.
Yes,
what
Stefan is doing the test. Yes.
I mean, maybe it's
He's
part
not
of
here, although we're talking about iodine. He's supposed to be here.
I mean, exactly.
Yeah, I don't know what's going on with them, man.
I mean, but I don't know if the regular tests, if we can test for iodine in like the Quest labs or LabCorp, maybe these are specific tests. Like I know he gets a lot of mitochondrial function tests and looks for a lot of metabolites. And so, yeah, so maybe we can
You
find
can do
out for
two
him
tests.
who's
You
using
can do two tests. One is the serum iodine level, but that before you start the treatment.
What's
And
that?
then there's the serum iodine level. And then the second one is the challenge test. You give certain dose of iodine by mouth and measure in the urine before and after. And you will know that how much retention is there. I think if it is more than 20% retention, there is a iodine deficiency.
Okay, that's a good one.
Okay.
Right.
And then,
Thank you.
yeah, good. It's my mom there. She finds those parts that she fills in the gaps. That's what
She feels like she's smart like her son. Like her mother, like her son. You're right.
all right, guys. Well, let's call it a night. I think we did our work.
Okay, well, everybody, make sure you go to this link that we talked about and get your CME. It's only $30. It's a company who's doing it for us. And support us as much as you can. And see you next week, Monday, 7:30 p.m. Sorry.
All
Take
right.
care, everybody, and good night.
Thank you. Good night.
Thank you. Bye.
Bye.